friends, இன்னைக்கு நம்ம என்ன பார்க்க போறோம்னா humerus and 60 seconds. Humerus is the longest bone in the upper limb. It is the bone of arm. It has upper end, shaft and lower end. Upper end possesses the head. It faces medially and it has three neck: anatomical neck, morphological neck and surgical neck. And it also possesses the lesser tubercle on the anterior aspect of the upper end and greater tubercle on the lateral side of the upper end. Muscle attachments of this bicipital group: lateral lip pectoralis major, medial lip teres major, and inflow latissimus dorsi. And the mnemonic is lady between two majors. And it has a shaft. It has three borders, three surfaces: anterior border, medial border, and lateral border. It has three surfaces: anterolateral surface, anteromedial surface, and posterior surface. In anterior border, it forms the anterior margin of deltoid tuberosity, and in lateral border, it forms the lateral aspect of the radial or spiral groove. And in lower end, it possesses articular part and non-articular part. So, in articular part, it forms a rounded capitula and a pulley-shaped trochlea. So, in non-articular part, it forms the medial epicondyle, lateral epicondyle, a coronal fossa just above the trochlea, and the radial fossa just above the capitula, and olecranon fossa on the posterior aspect of the lower end. Muscle attachments of shaft and lower end. Shaft, it has a delta tuberosity, so deltoid muscle is inserted. In lower end, medial epicondyle is a common origin for all the flexor muscles, and lateral epicondyle is a common origin for all the extensor muscles. Clinical anatomy of this humerus. So, three major sites are the common fractures for this humerus. One is surgical neck, and the shaft, and the supracondylar region. If the fracture occurs in the surgical neck, axillary nerve is damaged, and if the fracture occurs in the shaft, the radial groove and the radial nerve is damaged. If the fracture occurs in the supracondylar region, the ulnar nerve is damaged. இந்த வீடியோ உங்களுக்கு பிடிச்சிருக்குனா லைக் பண்ணுங்க, யூஸ்ஃபுல்லா இருந்துச்சுனா மெடிக்கோஸ்க்கு ஷேர் பண்ணுங்க. இந்த போன் ரிலேட்டடா இருக்கிற டவுட்ஸ் கமெண்ட் பண்ணுங்க. Follow for more.